Started. We have a lot to do today, and we've got at least one other committee member who is in traffic and on the way, so we're not going to wait on Atlanta traffic today. So I want to welcome everybody, and I wanted to start with a short video from our Lieutenant Governor. So can we tee that up, Emily?
Good morning. Hi, I'm Lieutenant Governor Burt Jones, and I'm sorry I can't be with you today for this very important committee hearing. I want to thank Chairman Kirkpatrick for all the great work she's doing in the foster care arena. This is something that's been very important to me personally, and it's been a priority of mine since being Lieutenant Governor, not just for our foster kids who are early in the system, but also for the children who are aging out. So it's great work that this committee has been doing, and we've got a great group of senators here on this committee, and I appreciate all the feedback that we've been getting from everyone around the state. So y'all have a good meeting and take care.
Lieutenant Governor and his staff have been very supportive of this whole effort from the very beginning, ever since we did the first study committee and created the Children and Families Committee. So that's much appreciated. And I will let you know that Senator Payne is live streaming. Hello, Senator Payne. He's got a fever, and we don't want people here with a fever, so he won't be here today. And so what we're going to focus on today is housing. We're going to talk about available voucher programs, and then we're going to hear from a number of service providers. The next meeting is on October 15th at 10 a.m., this same room, and it will be focused on education and workforce. I'm not sure yet if there's going to be a fourth meeting in November, so stay tuned for that. I'll announce that at the next meeting. There are a number of people live streaming. I know the Savannah Bananas are out there. If anybody's familiar with them, they have a fabulous program called Bananas Foster, focused on foster care, and they're going to come and see us at the Capitol during session. So hopefully they'll bring the guy on stilts with them. But anyway, so welcome to everybody online. I would, because we've got the live stream going on, I'd ask the speakers to please speak into the microphone so that the people online can hear. And also, because we have a tight time frame, everybody's been given time limits because we really need to be done by noon, because the committee members have a tour of a facility near the Capitol afterwards. So with that, let's get started. And first, you may have noticed some artwork in the back of the room, and I'm going to ask Darlene Lynch and Elton Dixon to come up to the mics and explain what we're looking at. Thank you for being here.
Thank you, Chairman, and thank you to the committee. My name is Darlene Lynch, and I am the Legal and Policy Director for Georgia Appleseed. We're a 20-year-old nonpartisan nonprofit legal center that works with to advance policies that keep children in supportive schools and stable homes. It's our pleasure today to be bringing you a very unique art exhibit that we partner with Elton Dixon from ENA Consulting, Coaching, and the ENA Foundation. The art has been created by Transition Age Youth in South Georgia. We call it See Me, Pieces of Life from Youth in Care, and I'll let Elton share some more.
Thank you. Good morning, Senators. Thank you very much for the opportunity to present today. Again, my name is Elton Dixon. ENA Coaching is an education and workforce development consultancy based out of Valdosta, Georgia. My wife and I launched back in 2013, and since then, we've had the privilege of working directly with youth in foster care. And through that work, we ended up partnering with Georgia Appleseed. So the artwork that you see in the back of the room represents just a small sample of work that young people in foster care group homes in Lowndes County and later on in Thomas County have produced just to tell their own stories about their experiences in care. The only instructions they were given were to express themselves, make sure there's no, vulgarity or nudity or anything like that, but they don't have to tell rosy stories, just whatever the truth is about their experiences. And the overwhelming majority of art that is produced tells stories of hope and their excitement about the future and the fulfillment of their potential as they see it. So I hope you get the chance to explore more of the exhibit and take some time to see the stories that are there. These are paintings, but some provided sculptures, some provided poems. Some of them did interviews to kind of tell their story that way, just to make sure that there's the broadest awareness of their feelings and their thoughts as we go forward. So this has been an amazing project. And some of the final thoughts coming out of that project were just to make sure that we as adults reflect on what those messages are coming out of the art. Some of them are just to make sure that we are honoring children's agency and their self-awareness, and that is something we absolutely work on. Ensuring foster care is a place of growth, not just survival. Connecting every child to a caring adult. Understanding that healing is vital, but there are many ways to heal. That was a major theme throughout a lot of the artwork. And then, are we instilling hope for their future? And I will say that this project has absolutely been a platform for that to happen, again, through this partnership with Georgia Appleseed. So I want to describe how we worked to take this just from being an expression in art to actually being a workforce development initiative over time. So I'm going to talk just very briefly about how we take a two-pronged approach to how we work with young people. In those group homes, we're looking at 15 to 18-year-olds primarily, and this is with the Georgia Sheriff's Boys Ranch and a couple other group homes that we connect with. So in that age range, there's the time is ticking in terms of how ready they can be for adult responsibilities. So that is the target age range when we start really applying, looking at their internal assets, their mindsets about moving forward, about how they receive coaching and use it as they transition to adulthood. And then also the external assets, which all of us as leaders, community programs, the colleagues that I look forward to meeting today are here to talk about what we can do to build bridges to success for these young people. So the way that we built this out, this first slide is not going to look very, very hopeful, but this does end very well, and I will wrap it into the discussion on housing. So what a lot of our young people are experiencing is this cliff at age 18 where they get to decide if they want to sign out of care. And a lot of times they're leaving without a real housing plan, without really any plans that are sustainable to make it once they transition to adulthood. And a lot of them say, well, it'll be different for me, coach. I know what I'm doing. I have someone that's going to help me. But what we wanted to show them, we show them this picture and let them know it is important for them to see themselves as the centerpiece. They're the ones that have to be the biggest stakeholder in their future. So once they see this, we start talking with them about financial literacy. And this is a part of the art project. We want them to not only complete the art, which they earn commissions for, $250 to $500, depending on how they participate in the project, but that they know how to use those earnings. We encourage them to work toward a savings of $10,000 for their first vehicle, for housing, for things that will be responsibilities after care. Now, you might imagine a young person hearing save $10,000 and they say, well, coach, I don't know how in the world I would do that. So they move on, but we show them strategies for how they would do that. We have very strong work-based learning programs in our community, especially with our Lowndes County's program. Those students are earning, on average, $4,000 per semester working real jobs in the high-demand career fields. And when we help them establish savings plans, they're able to use that for their future. And this is a very strong program in our county. Then there are programs like the IDA, which matches up to $3,000 for monies that are saved by those young people. So suddenly that $10,000 goal doesn't look so unrealistic. But what we want to also highlight is that youth in foster care exist in this ecosystem of sometimes competing interests. They hear a lot of voices, and a lot of them are not always well-informed voices about how they can take those next steps forward. So we spend a lot of time on professional development with foster care house parents. We found them to be the critical node in the network because they're the ones that are directly in front of the young people for the largest amount of time, and oftentimes they're the least prepared or informed about some of these opportunities that are available for young people. So we focus our professional development there, and when they learn what some of the education opportunities are, the post-secondary opportunities, and the workforce opportunities are, they can have conversations that extend that independent living planning beyond just a few weeks before that student walks out the door for the last time. You know, it can be a part of the lifestyle at the group home. So we think that's where the highest impact would be. We can forecast how many students are in that 15 to 17-year-old age range. We're focusing on Region 11, where we are. We're here from Lowndes County today. We work with Thomas County a little bit in Region 10. We look in future years through our foundation to reach out to Region 12, which has a high density of group homes. But for now, we're looking at very realistic numbers of how many students we can really address and start thinking about helping them develop plans for housing. Okay, so those earnings would roll back into their ability to pay for that first deposit and a few months of rent and be stable as they're getting jobs, as they're working toward their education, whatever it is that they're doing. And I want to highlight this organization here. We ended up doing a website design for them. They're Corley property developers. They take multi-housing units, old apartment buildings and motels and convert them. They are focused on the mental wellness arena, but we've talked to them about what if there were set aside units available for youth in care, and they're extremely excited about that. And we'd love to see incentives available for organizations that do this kind of work. As we're going forward, continuing what we do. This is the ENA Foundation. That's my QR code for anyone that would be interested. This Friday, through the Georgia Partnership for Excellence in Education, we've launched an initiative called Foster Care Forward, and that's where we talk through the rural learning networks, rural counties all around Georgia, about specific toolkits and plans that those organizations can put in place. We don't really need to start new things in many places. We just need to connect dots that already exist and use networks that are already functioning, like work-based learning, like some of the opportunities in the school system for youth to transition into real careers that break the cycle of foster care. So I'll be talking about this in much more depth Friday at 1 p.m. through Foster Care Forward, and I would love to connect with anyone in the room here that's interested in this aspect of our work. But again, we focus on education and workforce development, so I'd also love to attend that next session. But thank you very much again for the chance to present today, and look forward to sharing more later.
Thank you so much. Long way from Valdosta
Yes, ma'am.
to come up here.
It's
Appreciate
well
it.
worth it. Well worth it.
I just had a couple quick questions. One is, what happens to the artwork after it's completed?
It stays with Georgia Appleseed for now. You can probably.
Yes, so we are committed to sharing the artwork wherever we possibly can. So we welcome opportunities. If you all know of places that would want to display the artwork, we recently showed it at the United Way, to the Transition Age Youth Collaborative, and many other locations. So please let us know. We'll take it where we just brought it to Macon. We'll take it wherever we can.
Thank you. And then one other question. It sounds like you've got a lot of partnerships in your community with companies. Is that something that you all, is that how you've had so much success in working between your foundation and the employers in your community?
Yes, ma'am. We're fortunate in our community. We're actually in the middle of forming a college and career academy, and that project alone has brought together lots of industrial partners from across all sectors, focused on the high demand career fields, but just partners that want to support youth that might not want to take the traditional route to work and want to earn higher level credentials and more work experience by the time they graduate high school. So that has been a huge part of connecting with more industry.
Thank you so much. Thanks for your presentation. Other committee members have questions? What's your mic, Tim?
Thank you, Madam Chair. Apologies for being a few minutes late. I actually would just love to get your name since I walked in late.
Yes, ma'am. Elton Dixon.
Elton Dixon. And are you also with Appleseed, or are you with a separate?
We're partners with Georgia Appleseed. My company's called ENA Coaching, ENAY Coaching.
Oh, okay,
Yes.
I see it right here. Thank you so much. Thank you for
We'll
driving up.
send the presentation to committee members. Hopefully, I think your contact information is on there.
And we have a one-page flyer on Elton's business and foundation in there, too.
Okay,
Thank you.
great. Thank you.
All right, thank you.
Thank you.
Okay, and feel free to come back for the next meeting. Okay, next, we're going to hear from DCA. They're going to educate us about some of the voucher programs that kids that are aging out have access to, potentially, and what some of the hurdles might be. So we've got Ryan Evans and Laura Ann Holland. Thank you for being here.
Good morning, Madam Chair, members of the committee. Thank you for the opportunity to present to you about our voucher programs. I'm Ryan Evans, the Director of External Affairs for DCA, and I'm joined by my colleague Laura Ann Holland, who's the Director of Strategy and Key Initiatives. We're here to discuss DCA's role as one of 20 public housing authorities in the state that administer federal housing choice vouchers and special purpose vouchers. Again, thank you for the opportunity, and I'll turn it over to Laura Ann.
I'm really happy to be here with you guys today. As Ryan said, I'm the Director of Strategy and Key Initiatives, and in my role, I work really closely with our housing programs across all of our different areas, including our voucher program. So, Madam Chair, you asked us to come today to provide a straightforward explanation of the Federal Foster Youth to Independence Voucher Program. I'm here to attempt to answer that and to provide an explanation, but I would like to acknowledge, in my experience, this program is complex and complicated, and so it may be difficult to be as straightforward as we all would like out of this conversation.
Yeah, I think what I said is you'd need to dumb it down for the legislators.
So DCA is one of 20 housing choice voucher administrators in the state of Georgia. So each voucher administrator administers this program on HUD's behalf within a specific geography. HUD provides voucher funding for qualifying participants exclusively within each area of operation of each voucher administrator. As you see on the screen, these are the total voucher administering housing authorities in the state. So DCA has the largest geographical area of operation. We cover 149 counties with our voucher program, but we do not, in fact, cover the entire state with our voucher program. We share information with other voucher administrators, and we participate in statewide conferences, but DCA provides no oversight or convening authority for the other voucher administrators in the state. So HUD provides funding for the Housing Choice Voucher Program, and this includes for special purpose vouchers, which are relevant to the population that is this study committee's focus today. One of those special purpose vouchers is specifically for youth aging out of foster care who are currently or are at risk of homelessness. So that's an important caveat. These vouchers are called Foster Youth to Independence vouchers, FYI vouchers. You can see I've got some details on the screen that will be available for the committee members after this discussion today. But the number of vouchers that each voucher administrator receives is dependent upon the number of referrals that they have received from the Division of Family and Child Services for eligible young people. Additionally, there are special purpose vouchers that cover families at risk of separation due to housing instability. And these vouchers are called Family Unification Program vouchers, or FUP vouchers. They also require each voucher administrator to work with DFACS, the Division of Family and Child Services, to refer eligible families. So there are more than 500 FUP vouchers active in Georgia, but each housing authority has a different amount, from 0 to over 300. Currently, Atlanta Housing has the most FUP vouchers. They have over 300 under active leases, and other housing authorities, including DCA, do not have a single FUP voucher available. So each voucher administrator is eligible to apply through HUD processes for both the FYI and the FUP vouchers. And those processes look a bit different, which is what I will talk about next. So recently, HUD has created a non-competitive process to apply for FYI vouchers. This means that if a voucher administrator meets certain criteria, they are eligible to receive the vouchers for specific qualifying youth. So I'll walk you through this timeline, and I understand it's a little bit small on the screen, but the first step is that a community partner or an individual will identify themselves as an eligible young adult for the program. They will either then submit themselves or have a community partner submit on their behalf a formal referral form to the Division of Family and Child Services for confirmation of their eligibility. Our partners at DFACS are confirming their experience with the foster care system and their homelessness status at that point. So then we move on to actually processing the referral. So once DFACS makes those confirmations, they work with the community partner or the young adult to collect all of the required information that HUD requires for this federal program. And they submit that to DCA or another voucher administrator for the eligibility determination. And this is basically the point in which you qualify for the federal resource. So at that point, DCA or another voucher administrator applies individually for each specific eligible young adult. So HUD will then award based off of an individual's qualifying status. It looks a little bit different from other programs where you're given, a set allotment. Through this non-competitive process, we're applying only for qualifying individuals. And so then after those vouchers are received, then the process of searching for a unit and, submitting different requests for leases and having good tenant education, all of that comes in play after the voucher has been secured. And that's a really important piece of the puzzle as well. Through this non-competitive process, of course, the first step is establishing that referral partnership with the Division of Family and Child Services. And once that's done, each voucher administrator can apply through this non-competitive process for up to 25 vouchers a year to max out at 50 non-competitive vouchers total. So federal funding also becomes available for the Foster Youth to Independence program and the FUP program periodically through competitive processes that are typical of what we see from HUD. And the most recent competition took place last October. So over the last 18 months, we have appreciated working really closely with the Division of Family and Child Services to establish an effective working relationship. At this point, we have signed an agreement with the division. We outline our partnership in that agreement according to how to go after these federal funding opportunities. We've supported our counterparts at DFACS with providing information and guidance as they have established or worked to establish individual partnerships with the other voucher administrators across the state. And we've also been actively working with them to provide education and information to caseworkers, service providers, really anyone who needs to know about this voucher program. We're willing to talk with them and provide presentations so that more young people can access this resource. And while we've done what's in our authority to begin securing these vouchers and have successfully secured some, there are still limitations in our ability to fully utilize this resource and provide support to the eligible populations. And I can't speak for the other housing authorities and other voucher administrators in the state, but I imagine they have similar challenges that we do in effectively utilizing this resource. So some of those are, first, the federal voucher program actually limits individuals to live within the geography where they receive their voucher. It's possible for individuals to move to other geographies. That process is called portability. However, it's really costly for the voucher authority, and it creates a lot of additional administrative burden on the individual. And so it's not really incentivized to do that. So this means that if a young person receives a voucher from DCA to live in Gwinnett County, and they wanted to move from an apartment complex just at one end of South Norcross Tucker Road, just to the very other end, that would require a really burdensome process for them to go from one apartment complex to the other, and it wouldn't be easy for them. And so DCA has had some effort to share geographies for some special programs, but that's entirely dependent upon HUD's approval, and they have to be actively involved in each instance of coordination. The second challenge that we face is regarding the amount of funding that we are receiving for each voucher. And so we, of course, have received in process some referrals from DFACS and have secured some of those vouchers, but the amount of funding we've been awarded for the vouchers is significantly lower than the average rental amount that is charged in the areas where people are interested in living. We've asked for clarification from HUD on how they're determining what amount we're given for each voucher and are awaiting their response. But this means that the young adults who have qualified vouchers will still face challenges in actually being able to secure sustainable housing. I'm happy to answer any questions that you guys have, and I'm sure you will on the voucher program. But before doing so, I really would regret if I left out another incredibly relevant program for this population from our discussion. So DCA hosts another federally funded housing assistance program called a Continuum of Care. There are, of course, several continuums of care in the state, and DCA's covers 152 counties. Historically, the State Housing Trust Fund for the Homeless has been used to support DCA's Continuum of Care programming. And recently, we applied for and received special funding to host a youth homelessness demonstration project. And that project provides wraparound services to young adults experiencing homelessness, some of which have experience with the foster care system. So this program, which was made possible through a federally required match fund that was provided by the State Housing Trust Fund, DCA currently supports 18 youth housing focused projects throughout the state, and some of the providers on today's panel are participating in that project. These providers either directly provide housing option for those in need, or they help young people navigate systems in the state according to their individualized service plan. And through this pilot, we've been able to target interventions across lots of different housing statuses and have served more than 1,100 young people. It, of course, is a federal grant. It was recently renewed, and we remain hopeful, if it's available, to renew it for future years. So I'm happy to answer questions. And again, thanks so much for the chance to attempt to explain a very complicated program.
Thank you. Great job. So I've been trying to dig into this and understand it. And what I understand is that the individual housing authorities either participate or don't participate in accepting referrals. And so that's hurdle number one. And then the next hurdle is for the housing authorities to get the landlords or developers or whoever to participate in the program. And of course, funding is always an issue, but HUD has been very interested in working with us here in Georgia on making this process less cumbersome, and they're willing to come down here and speak to us. So it's not common in my experience to have a federal agency willing to engage at this level, and so I'm really looking forward to it. Won't be part of a committee meeting, but we'll get them down here and try to make this as smooth as possible for the kids. But you guys have what is called the balance of the state, exactly, which is everybody who doesn't have participation by an individual housing authority. Am I explaining that right?
Yes, that's correct.
Questions from the committee? Great job. Thank you so much. We may have more questions later that we'll hit you up with.
Yeah, no problem. Sounds good.
Okay, great. Okay, and more on housing, and to include vouchers and the Housing Trust Fund. Elizabeth Apley, would you come up and introduce yourself?
Good morning. Thank you, Madam Chair. You have been working so hard on this. We appreciate your leadership. My name is Elizabeth Apley. I'm here on behalf of the Georgia Supportive Housing Association, the Corporation for Supportive Housing, House ATL, Enterprise Community Partners, Presbyterians for a Better Georgia, and 9 to 5 Georgia, who all work on strengthening the policy and resources available to address housing needs and homelessness in Georgia. So access to housing is critical. Georgia law has long recognized that it is the state's policy to provide decent, safe, and affordable housing to all segments of the population of this state. That's not the reality, unfortunately. And the need for adequate housing is especially critical to prevent children from being placed into foster care, to support family reunification from out-of-home care, and to prevent homelessness among these transitioning age youth. Federal funds are available, and a lot of my slides are going to duplicate what Laura Ann has just done so well. But what we know, and we don't want to act preliminarily, but in fact the data is very clear that Georgia is lagging the rest of the country. We're lagging in what we could be doing to access these federal funds in order to improve housing outcomes for transitioning age youth. We know that this population is at extreme risk of homelessness. In fact, foster care is referred to as the highway to homelessness. We have about 700 youth leaving foster care each year, and national data and local data show that the rate of homelessness immediately on leaving care and over those next years up to the age of 26 are somewhere between 20 and 50% of those youth end up homeless. We also know that too many children in Georgia are being placed into foster care due to housing issues. In fact, in fiscal year 2023, we had 4,810 children entering the foster care system in Georgia. Of those, 1,420 were removed due to issues that either were exclusively or included homelessness or inadequate housing. And the breakdown of those is 10% entered foster care because of homelessness, and fully 19% were exclusively or partially due to inadequate housing conditions. The national average, in contrast, that year was 11% being placed into foster care due to housing issues. So I show this slide from Georgia State that highlights that 19% due to inadequate housing. That's on top of the 10% for homelessness. And what Georgia State says is that this is a resource and family support issue rather than a child abuse and neglect issue. It's something we can fix with money. So these two housing voucher programs that Laura Ann has discussed, FYI and FUP, both address housing instability. Georgia's failing to adequately utilize these programs, and my focus is on addressing barriers and solutions in order to maximize use. So one of the key things about the FYI is that it's available on demand. It's a special purpose voucher, as Laura Ann said. These housing choice vouchers nationally, only 1 in 4 eligible household is actually receiving a voucher. So it's very hard to get, but they're trying to treat these FYI and FUP differently. The FYI are available on demand. That 50 voucher cap that was referred to in the prior testimony has been removed in legislation just passed. So the whole point is to create that basic foundation of housing so that these youth can access education, employment, and health care as they mature. So who is eligible are youth who are between the ages of 18 to 24 when they receive the voucher. So they can receive it within 90 or 180 days of exiting care and are at risk of or actually homeless at age 16 or older, and pregnant and parenting youth are also eligible. So you get that FYI, and it provides you 36 months of housing assistance. That can be extended for an additional 24 months, paired with support services that are so critically important. The youth's obligation to pay rent is set at 30% of household income. If that household income is 0, they are obligated to pay only the minimum rent that is set by the local public housing authority, and that can be anywhere between $0 and $50 a month. The rest of the rent is paid by the housing authority, and they actually include utilities in that calculation as well, so that's also supported. So the first step to accessing these vouchers is for the local public housing authority, or DCA as a public housing authority, to amend its administrative plan, as DCA has done, and sign an MOU with DFACS. That's a simple paperwork process. We have 20 housing authorities across the state of Georgia, and all of them have not done that. We ranked 45th in the country in our utilization of the FYI in 2024. And while the numbers have not been shared and we're still working to get all the data, what has been reported to us is that DCA has issued 4, maybe 6 vouchers, 149 counties. DFACS reported that since July 1, 2024, they received 110 referrals, they made 110 referrals to public housing authorities, and only 55 have resulted in vouchers being issued. That is a handful. The population of youth who've left foster care, who are between age 18 and 24, that's multiplying 700 times 6, that's 4,300 youth across the state who, if they're homeless or potentially homeless, would be eligible. And out of those 20 housing authorities, only 3 actually issued those 55 vouchers. The data is still rough. We're working on it, but I'm trying to give some reality to the magnitude of the problem. So these are the PHAs who have entered into an MOU with DFACS. These 8, these are the 12 who have not. And so in order to move forward, we've got to have those MOUs in place. They've got to have those MOUs in place. And you heard Laura Ann say that DCA, the department, doesn't have the authority to require that. So we're trying to figure out, and this conversation with HUD may help us. They're not required to do it, but what is the lever that the state can utilize to make sure that this happens? Next, we need to strengthen. I know DFACS caseworkers are being trained. We need to strengthen that training. They are the key point for eligibility. You heard the first gentleman testify that youth are aging out without a housing plan. Well, there's paper and paper for this transition planning, but it doesn't specify housing in the way that it needs to be specified to make sure that there is a housing plan and that they know about the voucher and that we're getting them access to it so that they don't fall out of foster care and into homelessness. One of the ways to track what's happening more effectively is to create a publicly available dashboard to track those referrals, submissions, utilizations, and outcomes. I'm not talking about people's names, but by housing authority, who's getting the referrals, who's making good on them, and who's not. And to create a publicly accessible website for these youth to access care. You know, once they leave care, they're adults. We're not tracking them. We can't impose legal obligations on them. But we know that other states like Kentucky, North Carolina, Illinois, and California have created publicly facing websites for the youth to go online and apply. And it's just the initial referral. We'll then engage with them to support that application. But you know, in this day and age, that's a key way to get them connected. And we need to increase the education and awareness about these programs with the people interfacing with these youth after they leave. So I'm going to talk briefly about the FUP. It's different than the Fostering Youth Independence, but I think there were another set of words that I failed to say about the FYI in my rush to meet my time limit. The FYI are available on demand. Unlike the Housing Choice Voucher, where you've got that waiting list with thousands and thousands of people, limited times when they open the waiting list, that doesn't apply to the FYI. They are available on demand, and we're not getting them. So the FUP is about preventing youth from being placed into foster care in the first instance. That's housing supports that are available for families who are at imminent risk of having children placed into foster care due to housing stability or homelessness. Those vouchers also are available to speed reunification. We're told by the people who know that housing inadequacy is a major barrier to families being reunified. These vouchers can help to address that. And the third aspect of the FUP is to provide vouchers to aging out youth for housing. I think I've told you who's eligible. Again, it's for youth age 18 to 24. It provides for the families in the two categories I described. There's no time limit on the receipt of the housing voucher. For the FUP, for transition-age youth, for youth who've been in care, it's 36 months plus the addition of 24 months. Again, you've got to have that amendment to the administrative plan by the PHA, and then you've got to have that MOU with DFACS. DFACS verifies eligibility, the Housing Authority issues the voucher, and DFACS provides the supportive services. The barriers are that few youth are being referred. We are ending up with more children in foster care because we're not using the FUP, and that also has the effect of limiting access to the FYI vouchers. We don't have funding being dedicated to support services, and as the chairman already mentioned, there are real challenges in getting, we don't have source of income protections in Georgia, and so there are real problems in getting landlords to participate, especially when you're trying to house a young person. So the best practices would be to increase the use of the FUP to prevent children being removed from care in the first instance, to increase the use to support reunification at the earliest opportunity, and to use them for these transition youth. We need to set aside vouchers for youth. We need to cross-train housing and child welfare staff on who's eligible, how to refer, and what the process is. And we need to operationalize interagency meetings to resolve the issues and address whatever barriers there are. Illinois uses Chafee funds to provide housing advocates to support youth. That's been very effective. So we've got to engage every PHA to establish an MOU with DFACS, expand DFACS training and referral pipeline, create a public dashboard tracking referral submissions, use, and outcomes, fund and support these necessary complementary youth services, implement set-asides, and increase awareness. I just want to take a moment to explain that there are ways to also supplement what's available through the FYI and the FUP in order to support housing for these youth. We had in 2022 over $200 million in unspent federal TANF funds that can be used for housing supports for vulnerable families. That year, 57% of our TANF dollars were spent on child welfare services. That's over 6 times the national average of 9%. We spent only 18% of our TANF funding on basic assistance that could include housing and shelter. And so we are focusing our resources on crisis intervention rather than on prevention, and we all know that's the wrong approach. Other states have also made the choice to use state dollars in addition to those federal TANF dollars to support housing, to reduce foster care. It costs a fraction to support housing stability as compared to the cost of foster care. So we could need to consider reducing or ending the use of housing inadequacy or homelessness as a reason to place removing children from their families. We need to increase the use of the FUP and the FYI, increase the use of unspent TANF dollars, and redirect TANF spending to prevention, in addition to caring, obviously, for those who are in crisis, and to expand or launch, in some instances, landlord engagement strategies to increase unit availability. Oh, this is the old slides, so we don't even have my... The chairman asked me to talk about the Housing Trust Fund for the homeless. Did those get in here?
While he's loading that, I had a couple questions. The housing authorities are local, separate legal entities. The state doesn't have any authority over the PHAs. So how does the state have a role in increasing the PHAs that don't want to participate for whatever reason, whether it's staffing or whatever the reason is? Would it help if there was some kind of relationship between the county DFACS entities and the local PHAs? Or do you have any other ideas of how to fix that?
Madam Chair, I'm committed to continuing to work with you in researching with HUD and with national experts what levers. It may be a carrot approach rather than a stick. We may not be able to legally require them, but we can incentivize. I would also mention that there has been a lot of media attention on this issue. WABE, the opinion piece in the February Georgia Trend was by the publisher talking specifically about this issue of transitioning age youth being homeless, our failure to use what's available federally. The First Lady, Melania Trump, is prioritizing this issue and touted the inclusion of $25 million federally for the FYI. So I think increasing public awareness, looking for those levers and incentives, increasing awareness, and holding people accountable. If we have a dashboard, it's been very difficult, as you know, to get the information about what's actually happened and where the problems are. And so once we have that publicly facing dashboard showing who's being referred, who's getting vouchers, we'll know where the problem areas are and can redirect efforts to. But I'm going to continue to work on that with you. I don't know if they found my other
Yeah, and
PowerPoint.
Senator Hatchett.
I'm sorry.
Thank you for your presentation. I have, I think, several questions. First, you said something about the FYIs, and you said they're available on demand, and we aren't getting them. And then I'm just going to try to lay this all out there and see if you can help me tie the knot on the end. So you talked about the FYIs. You talked about needing MOUs with the public housing authorities, more training for DFACS workers, a platform for foster youth to go to and apply for these. And then you came back to the TANF benefits and saying that 57% of that money is used on child welfare, which is 4 times the national average.
It's over 6 times the national
6
average.
times. So I guess my question is, what I'm gathering is the resources are out there, but we aren't utilizing them in an efficient way that would best benefit foster youth and foster families in the state of Georgia, because you know how to access them, but maybe the families don't, the foster kids don't, and the DFACS workers don't know how to advise and direct them appropriately?
So, you know, there are problems with awareness. The housing authorities are under-resourced. This is another staff task. They're not legally required to do it. And so, but we're doing a weaker job than the rest of the country. We were 45th in the country in 2024. So,
well, do you equate the 57% of TANF benefits being used in the way we're using them to the failure of foster youth the failure of them to receive other available monies?
no, sir. I was trying to, I apologize. The problem with accessing the FYI and the FUP result in more children ending up in foster care and for a longer period of time. Other states are using TANF dollars to prevent children from being placed into foster care on the prevention end rather than the child welfare end. And they're also supplementing those efforts with state dollars because they know that housing stability supports are much less expensive than foster care. So the TANF discussion that I offered was just to say that there are other ways that the state can allocate federal resources to support housing for this population that has proven very effective in other states.
Okay, I understand that now. So with the FYIs and the FUPs,
Yeah.
is that, or what I'm hearing is we've got buckets of resources and they're just sitting here
Yes, sir.
and they're not being utilized.
Right.
And what's the main reason for that? I don't mean to put you on the spot.
No, the main
but
reason
I wanna
is
know.
that they're not federally required to do it, and the state, as the chairman just said, doesn't control the public housing authorities that are overworked and understaffed, but we know we can do better. 45 other states are doing better. We can do better too. So we need the steps that we suggest are to get each public housing authority, those 12 on the list of shame that haven't entered into an MOU with DFACS, need to sign those MOUs. We can do more to train the caseworkers. We need that publicly facing dashboard to show who's doing what's possible and who's not. And we need to make access to those referrals available in a publicly facing website that youth can access. Those are some of the suggestions that we've developed, but we're continuing to work on it, and you've described the problem very well.
Thank you.
Can you briefly
Yes, ma'am.
cover the Housing Trust
Housing
Fund?
Trust
Because
Fund,
we've got a bunch of people that are waiting to testify also.
Yes, thank you for the opportunity. So the State Housing Trust Fund was created in 1989. Governor Joe Frank Harris was governor then. This was his initiative. It was to create a broad, recurring source of revenue for housing, which is expensive, to address our high unmet housing need for low-income persons. And it gave very broad statutory authority to increase the resources to create and support rental housing and support home ownership. The legislature rejected the constitutional amendment for the dedication of revenue, so we have been reliant on annual appropriations, which have remained stagnant for most of the last 30 years at $3 million a year. They did allow the amendment, the constitutional amendment for the non-lapsing of funds to the trust fund to pass, so they are able to hold those funds without lapsing. They also renamed it the Housing Trust Fund for the Homeless, but they didn't change the statutory authority, which I quote here, residential housing projects to enhance residential housing opportunities for low-income persons, very broad, including but not limiting to financing the acquisition, rehabilitation, improvement, or construction of residential rental housing, and interest rate and down payment assistance to enhance home ownership. Very broad authority. And so it defines homelessness and low income very broadly. It is funded, as I said, with these annual appropriations. While the appropriations were unreasonably low at about $3.2 million a year for decades, DCA did an excellent job of leveraging those funds, and in 2022 they reported that every dollar invested in the trust fund was leveraged with $10.50 in federal funds, so they're doing a great job with that. Laura Ann already talked about the Homeless Youth Demonstration Grant, and y'all may recall that in 2024 you added a new program to the State Housing Trust Fund with the Stable Accountable Housing Initiative that provided grants for transitional housing for up to 18 months, conditioned on work, sobriety, and drug testing. So I'm going to skip this. The total state funds in the FY26 budget, we've been advocating for large increases. We've gradually gotten them up to $7.8 million with a $2.5 million increase over the 7.8 in FY25, with an increase to the transitional housing up to 1.75. Keep in mind that in our state budget, all the funding for rental housing is federal. I want to mention this report of the state auditor that was issued in January of 2024. It was mandated by SB 62. The legislature directed the audit to review all federal, state, and local funds for homelessness. And what he found is that these programs are primarily funded with federal grants, that our response to homelessness would be improved by statewide coordination, that we lack such a response, and that other states have adopted broad strategies for preventing and ameliorating homelessness, including the collection and aggregation of data. And so specifically, the auditor found that we spent between 2018 and 2023 only $158 million in state funding on homelessness. $123 million of that went to the Georgia Housing Voucher Program, to DBHDD, under the Olmstead Agreement, to fund the supportive housing vouchers for chronically homeless people with severe and persistent mental illness. That program remains dramatically underfunded. DCA received only $17 million for the trust fund, about that $3 million a year, and a small allocation to reentry housing for felons who were being held in prison, ready to be released, but for the fact that they had nowhere to go, to live. So the auditor's recommendations are for the General Assembly to establish a council responsible for statewide coordination, as has been done in 33 other states and recommended by the United States Federal Agency on Homelessness. And you may recall, while I got the year wrong, the Senate passed legislation to do that, to create an interagency council in 2024. Didn't pass the House, and again in 2025, not 1025. It seemed like a long time ago. SB 170 that passed the Senate and did not pass the House. And he also recommended requiring the use of the HMIS, the Homeless Management Information System, to conduct a statewide analysis of homeless conditions and trends. So what we recommend is increasing funding to the State Housing Trust Fund. Casey Carpenter has HB 689 that would create flexible local grants that could be used to prevent eviction. Emergency rental assistance is identified by the Department of Community Affairs as a critical need. The federally funded pilot program is expiring this very month, and demand for emergency rental assistance remains high. We also advocate for the allocation of $1 billion in unobligated state surplus to the Housing Trust Fund to prevent and ameliorate homelessness. The capacity of the trust fund to hold that money without lapsing makes it a perfect venue for surplus funds. Department of Community Affairs would direct how that is being spent, and it would create important resources that are needed without creating a recurring obligation. And finally, to pass SB 170 to create the statewide interagency council on homelessness.
Thank you. We did pass that in the Senate, by the way, so you'll have to talk to the House about finishing that. And we also passed Chairman Efstration's bill in 2024 that I carried that established those community grants. So I know that's new. A new source of funding that it's too soon to see how that's going to work out. But
Yes.
thank you very much for your
you.
testimony.
Appreciate it. Thank you for your time.
I'm going to hold up on questions for now because we got a lot more
And
people.
I'm available at any
Thank you. Okay, and we'll send all these presentations to the whole committee. I'd like to ask Claire Cantrell to come up. Juanita Stedman, who many of you know for Together Georgia, was not able to be with us today, and so she has asked Claire to present her information. So the floor is yours. Thank you.
Thank you. I'm going to give y'all a little screen break, and I'm just going to talk for a couple of minutes, and hopefully have fewer statistics and acronyms for you. So give everybody a little bit of a break. As Chairwoman Kirkpatrick said, my name is Claire Cantrell. I am the Deputy Director of Together Georgia. We are the statewide membership association of child and family service providers. Our Executive Director, who many of you know, Judge Juanita Stedman, sends her regards and her gratitude for the work you are all doing in this space. Senator Parent, you are my senator. I live in downtown Decatur. On behalf of our 94 member organizations across the state, I want to thank you for your commitment to improving services and supports for the young people transitioning out of care. Your leadership on this issue matters deeply to providers, to advocates, and most importantly, to the youth themselves. Together Georgia, my organization, was privileged to convene a transition age youth cohort under the guidance of Casey Family Programs, who we met with 3 weeks ago. The purpose of the cohort was to develop the capacity of providers and our system partners to improve outcomes for our transition age youth in foster care. This collaborative multidisciplinary work group met over the course of 2023 and 2024 by bringing together providers, advocates, and young adults with lived experience to identify gaps, share best practices, and propose solutions. Many of our stakeholders and members of this cohort are in the room, including Georgia Appleseed, CASA, MAC, DFACS, DJJ, and several provider agencies. I'm probably forgetting someone. It was a really robust and, like I said, collaborative multidisciplinary group. Late last year, our cohort transitioned into a chapter which now meets bi-monthly to continue the work of the vision of the cohort. You'll be provided with these findings and all of our supporting documents and recommendations from the cohort, but our chapter continues in work groups studying our 3 key focus areas, which are housing, ensuring youth have access to safe, stable, and affordable options, which you see is harder than it seems. Workforce development and education, expanding pathways to employment, training, and higher education, which we hope to share more about at the next meeting. And building connections, fostering supportive adult and peer relationships that sustain young people well beyond their time in care. Our cohort and chapter have identified persistent gaps that warrant your attention. Many of these are not new to you, as they were covered by the MAC empowerment representatives at the last meeting. Safe and affordable housing remains out of reach for many, many, many of these youth, and our providers do not have consistent evidence-based program models to support youth transitioning out of care into independent living. Too many of these young people are also exiting care without life skills and preparedness that's required to live independently, including educational preparedness and workforce readiness. Youth are aging out without trustworthy, supportive community networks to help them find stability and independence. Across all of these areas, there's a need for greater support, both programmatic and financial, to help these youth transition successfully into adulthood. And I believe all of these tie back directly to housing. It's difficult to find a job or to get a good educational outcome when you don't know where you're going to sleep that night. I'm now privileged to turn the mic over to several of my member providers who are doing this vital and important work every day. You will be able to hear about the challenges as well as the opportunities that they have identified for these youth. They represent strong, innovative organizations that are seeking solutions to help these young people, and I'm so proud of the work they do. I'm inspired every single day by each one of them, and I'm glad that I get to introduce myself first because they're all really impressive and honestly would be a tough act for me to follow. We are grateful for the opportunity to bring provider perspectives to this committee, and we look forward to working with you on solutions that give our young people the best possible start in adulthood. Thank you again for your time and your commitment to these young adults, and with that, I will yield the floor to my members. And happy to answer any questions, but
Looking forward to hearing from all the folks that are in the trenches. The first one on our list is Wellroot Family Services, Allison Ash. Welcome.
Good morning, or almost afternoon. My name is Allison Ash, and I'm the president and CEO at Wellroot Family Services. You may know us better as the United Methodist Children's Home. We were established in 1971 and are one of the state's oldest child welfare organizations. I do want to mention that prior to Wellroot Family Services, I was the CEO at Covenant House, Georgia, which is one of the state's largest, might be the state's largest homeless shelter for youth 18 to 24 years old. And a third of the young people that we served at Covenant House have aged out of Georgia's foster care system, and nearly 50% have experience with Georgia's foster care system. So Casey shared with you about the negative outcomes that face young people aging out of the foster care system, but I wanted to make sure you know that even those are national statistics, they are true here in our state of Georgia. At Wellroot, we work on the continuum of child welfare. We work in the area of prevention services by providing support to parents, behavioral health programming, family housing. You heard about the FUP vouchers. We do utilize those vouchers. We provide foster care and support for children in foster care. We specifically focus on looking for foster families that work with teenagers, because we know when a young person comes into care later, they have worse outcomes. And we work with young people who are aging out of the foster care system. We have three, so actually I want to start back with what Casey, I just want to reiterate kind of I'm not going to talk about all the negative outcomes that Casey talked about, but I do want to refocus a little bit on the needs of young people as they age out of foster care. They have complex trauma. That's the first one. They have, whether it's severe poverty and neglect in their background or abuse in their background, they have trauma before they ever enter into the system. And then they are taken out of their home, put into a new home, often a new school system, and many times have multiple placements, which just compounds their trauma. When they come to us, they need time and skilled professionals to be able to work with them to heal from that trauma. They also need meaningful connections, which I think we also heard from Casey. They move from family to family, from school system to school system. They don't necessarily have one trusted adult that they know that can be their meaningful connection. And while we as a system are doing much better at identifying family members, aunts, uncles, grandparents, there's still a significant need for meaningful connections for these young people. Obviously, we've talked a lot about the fact they need safe and affordable housing. They need preparation for adulthood. When we did the cohort that Claire mentioned, we did a lot of focus groups with young people and surveys with young people, and we heard time and again how unprepared they were to turn 18. We have a risk-averse system, as we should, but it means that when a young person's in a group home or they're in a foster home, their foster parent, and I think one of our young people actually talked about this at the last session, are not as inclined to let them go work at McDonald's where they could get, burnt or somehow hurt at work. They're not as inclined to teach them how to cook where they could cut their finger with a knife. We had one young woman that we talked to in a focus group that said she moved into her independent living program apartment and opened a drawer and saw a drawer full of cooking knives and had never touched one before at 18 years old, yet was expected to cook for herself. So they're not receiving the preparation in terms of life skills that they need while they are in care. Most importantly, I just really want to underscore that they need time. When you think about the people in your lives who are 18 to 21 years old, I know when I was 18 to 21 years old, I went home to my parents several times. It took me 5 years to graduate from college. I needed time as a well-supported, well-resourced, well-taken care of child. These young people have complex trauma. We need to work with them on a lot of things before we can get them educated or employed. So time is important, and time to catch up, like we heard from Ms. Stout. She lost an entire year of high school. So I just it's complex what these young people face. We have transitional and independent living at Wellroot, which is basically extended foster care. We own an apartment building in Decatur where we have 29 beds for these young people. We teach them the full, provide the full wraparound of services, life skills services, again, teaching them how to cook, how to bank, how to budget, how to coupon, how to grocery shop. We provide individual and group mental health and experiential health care, mental health, and we provide college and career planning. The young people that come into this program are 18, and a significant number of them are actually still in high school. So supporting them finishing high school, because they are behind, like we heard before, finishing them and supporting high school, helping them do their FAFSA, getting them into college, and supporting them through that process. Our outcomes are better than the national average. 74% of our youth complete high school or their GED, compared to 50% nationally, and 38% transition to college or vocational training program as opposed to 20% nationally. I really want to focus on our transitional living program. So the difference in transitional and independent living is basically the level of independence. The DPACS independent specialists work with the young people as they're approaching 18. They look at whether they've finished high school or have their GED. If they have not finished high school or do not have their GED, they are recommended to the transitional living program as opposed to the independent living program. There's also a scattered site assessment that is done plan that it basically identifies whether they have the ability to go in and live in their own apartment. There are far fewer transitional living programs in the state than independent living programs, and I believe that is because it's much more expensive to run a transitional living program. In the state of Georgia, the reimbursement rate for transitional living is the same as the reimbursement rate for independent living. We have both programs. We operate in the black, or right in the black, in independent living, which is where we house them in scattered site apartments out in the community and provide case management. In transitional living, our 5-year average for that budget is $1.3 million. Our reimbursement from DFAC's 5-year average is $740,000, which means we are supplementing that program a rate of 40% per year. It should be the state's responsibility to fund us at a level that we can sufficiently serve those young people. We consistently have good outcomes, and we consistently have good scores with DFACs. The reason I raise this for you is we are a 154-year-old organization that has an endowment. We are only able to do the work we do because we can self-fund some of the work. Other agencies don't have that gift that we have, and they need your help to get the rates up to a level that they can provide the services that are needed for these young people. We also are one of the participants in the Youth Homelessness Demonstration Project. I won't go into that because DCA and Ms. Apley both did as well. But what I will tell you about this, being a almost 2-decade veteran of this field, is that HUD has realized that HUD leverages through the Youth Homelessness Demonstration Projects the Rapid Rehousing Program, but layers on services. We are actually doing national advocacy as an organization to talk to the First Lady's office about layering on services with the FYI voucher. I have no idea whether we'll be successful, but what HUD has found through the Rapid Rehousing Program is that services and transitional living as a component of the program is needed for young people. It needs to be a little bit different than it is for adult rapid rehousing programs. So my recommendations as a provider, number one, would be to increase the TLP rates. The young people in TLP don't have their high school degree yet. They have very complex trauma. They need more support. They need 24/7 supervision, and that is more expensive than ILP. Those rates should not be the same. I'd also, national research shows, and the youth homelessness community has come along to the fact that young peoples are not ready for independence at their 21st birthday. Research shows that brain development now goes all the way up to the 26th birthday, yet at the 21st birthday, we can no longer serve young people in our TLP or ILP programs. And we see time and time again that they're not ready to be transitioned out on their own. Again, we have the resources to provide aftercare for them. Most providers don't. So I know that is probably a big price tag proposition and not something that we could do right now, but I would encourage that we look into whether other states have a higher age than 21 and what the cost might be to raise the age. And of course, we support helping DCA and DFACs extend the use of the FYI voucher. I actually led the workforce component. I understand now that you are going to be talking about that next time, but since I'm here, I just want to say I think employers need to be incentivized, whether that's through some sort of financial incentive or tax incentive or just hearing from you all that they should be hiring these young people. It takes extra work for them. Again, hiring a young person that doesn't have life skills, that has complex trauma, takes extra work for an employer, but if employers would be willing to hire our young people, and perhaps if there was funding for us to provide extra case management for those young people, I'm sure there's employers that would like to help them. And then we need programs for young people who are in foster care that get them ready for employment. Again, those life skills and basic work skills. And there's national programs out there, so it's not a matter of creating one, it's a matter of having the funding to go out and implement one here in Georgia. The most successful one in New York, private philanthropy paid for it, but then the child welfare system took over paying for it once they proved the outcomes of it. It's called Fair Futures. And then just a few other recommendations. I would recommend funding aftercare services. If you can't fund extending foster care past the age of the 21st birthday, providers need funding to be able to follow a young person once they exit the TLP and ILP programs. Enhance access to critical mental and behavioral health services. Young people protect Medicaid for youth. I'm not sure exactly what the state role could be here, but in the new cuts to Medicaid, adults are required to work to receive Medicaid. A lot of our young people are not prepared to work. So as the state drafts its Medicaid plan, if there are protections that could be put in place for young people, that would be important. And I will just reiterate what Ms. Apley said, is prevention services, prevention services, prevention services. Casey shared last week that 32% of the young people that come into care as a teenager come in because of behavioral health. That is, and that's a lot of the experiences we heard at Covenant House. That is entirely preventable. We have a program called Functional Family Therapy at Wellroot that is excellent at has excellent national outcomes at keeping children in the home. We have 18 therapists. We do not receive $1 from the Department of Family and Children's Services for that program. I think it was, I have it written down, 41% of teenagers that come into care is due to neglect. A large portion of that is due to housing instability, so better utilization of the FUP vouchers and other housing resources. I'm glad you had Ms. Apley's talk about the State Housing Trust Fund, because housing for the parents of kids coming into foster care and youth is critically important. And I'm just going to add one real quick. It is very true that housing, even when you get the vouchers, is too expensive. So we at Wellroot are in the process of leveraging the low-income housing tax credit to build our own apartment complex. And there's one thing that DCA could do to help with that process, and that is to add DFACS as a referring entity into the low-income housing tax credit qualified application. So thank you all so much for having me today, and would welcome any questions.
I have a few questions for you. So the age of the people that you're serving that live in your facility, are they all over 18 or 18 and over?
17 and a half to
17
yes,
okay.
to 21.
And do you feel that just because you've worked in this environment for a long time, do you feel that there are more kids that are entering care at a later age than they used to? Because the numbers for foster care are going down, but the kids aging out, that number's not really going down. So I just wonder if they're coming in later with more challenges due to, mental health or whatever. I don't know what you're seeing with that.
I'm going to just tell you anecdotally what I think, and I do think more are coming in because of behavioral health challenges. I mean, I think we know that it's a very difficult time for children and youth right now, and behavioral challenges have escalated within families.
Okay, well, we can argue about what causes that, whether social media plays a role or whatever, but that's
I think
outside
it's very
the
complex,
scope of what we're doing. And then, we've developed a lot of programs through the legislature in the last few years for people coming out of incarceration.
Mm-hmm.
So I don't know why we couldn't do something similar for kids aging out of foster care, but that
would be fantastic.
Editorial comment. And so the behavioral health things, we've been spending a lot of time and resources trying to address that. So I'm glad that you highlighted that, because I know we've got a new crisis center that just opened down in Macon, and we're working hard on access to providers that specialize in that area. But, it's a big problem, so it's going to be piecemealing every solution that we can find.
Our take on that, if I could say, is that because we've been working on it, you've been working on it for a long time, is we don't have enough providers in the state. We've been, we could talk a lot about that. One of the things that we've done is advocacy around getting more, getting the Medicaid process simpler so we can have more providers, but then there's obviously a workforce piece as well. But I think it's very important, and I think this might have been I think it is in the school safety bill, that our communities need to be able to recognize young people who are struggling, and having schools, police officers, all community providers trained in trauma and trained in resiliency so that they can identify a young person when they're struggling would really help with that issue, and that includes our young people that we serve.
Questions from the committee? Thank you so much for the work that you do and for speaking to us today.
Thank you for having me.
Okay, next we've got Youth Villages. Jametta Wheeler, I think, is going to speak. I hope I pronounced your name right. Thank you for being with us. The floor is yours.
Thank you. Good morning, Madam Chair and members of the committee. My name is Jamita Wheeler, and I am with Youth Villages, Georgia. I am the state manager for our community-based programs in Georgia, Alabama, and Louisiana. And I have my supervisor here, and I'll let her introduce herself.
I'm Caroline Hanna, Managing Director of Community-Based Services. I work with Jamita on the 3 states that she's over, in addition to Florida, Kentucky, and Oregon.
We're honored to speak with you all today on behalf of Youth Villages, who is a national leader in child welfare. Youth Villages currently provides services in 29 states and DC, and our focus is on our mission is on helping children, families, and young adults live successfully. We are both, as an organization, an advocate as well as a committed service provider for transition-age youth. At Youth Villages, we believe that every young person aging out of foster care should have the support they need to achieve their goals and reach their full potential. And for over 2 decades, we have worked to make that vision a reality through our LifeSet program, which is our signature program designed specifically for transition-age youth. We all know that young people aging out of the child welfare system experience a variety of challenges, and I just want to give you guys a brief example of how the program has empowered one of our young adults that we work with. We work with a 19-year-old male who came to us in a foster home in Metro Atlanta, in a group home in Metro Atlanta, and his whole goal was to just obtain stable housing for the first time in his life. And we worked very closely with DFACS, with the case manager, because we didn't know how to access the housing voucher. So we worked very closely with them to help him get his voucher access. We did have a barrier because he had a criminal record, and so we had to then work collaboratively with his probation officer to make sure that we were able to get him the anger management skills through our LifeSet program, and he was able then to clear his criminal record, and he was approved for HUD housing, and now lives independently in his own apartment. So that's just an example of how our LifeSet program can support these young people. LifeSet is one of the most effective programs in the country, helping young people ages 17 to 22 navigate this complex transition into adulthood. It's an evidence-informed program that provides intensive yet individualized support from our trained specialists who help our youth set and achieve their goals, with the focus on education, employment, housing, which we're speaking about today, mental and physical health, and building long-lasting support systems. Since Youth Villages created the LifeSet model back in 1999, we have helped over 35,000 young adults across the country. LifeSet is delivered currently in 21 of our 29 states and DC, and we reach more than 6,000 young adults on a yearly basis. We have had a rigorous study conducted by MDRC that found that LifeSet resulted in improved mental health.
Sorry, what's MDRC?
You know, that's funny. I've met with some of the folks from MDRC, and even they don't recall what it stands for.
It's a social research firm, though, that conducted these studies for us. But the study resulted in improved mental health, increased employment and earnings. It also reduced domestic partner violence and economic hardships. Notably, the study also found that LifeSet reduced homelessness by helping young adults secure housing within their communities without us directly providing brick and mortar housing with our program. In Georgia specifically, LifeSet is making a difference. Last year, we served more than 200 young adults in the state. We currently partner with Amerigroup Georgia Families 360 Medicaid plan to service those young adults who are aging out of care through DFACS. We also partner with DBHDD and to serve those young people with the mental and behavioral health needs who've reached adulthood but have limited family supports, and they are not covered by the Georgia Families 360 plan. Although we have these great partnerships, of course, we all know the need is greater than our current reach. In Georgia, as has been previously mentioned, over 700 young people age out of care each year. Many of them face homelessness, unemployment, and untreated trauma, as Allison mentioned. So we realize the need to do more to provide tailored and evidence-based services to young people across the state. Youth Villages is very fortunate to have received philanthropic funding to scale our LifeSet model nationally. We've awarded LifeSet matching grants to create public-private partnerships with more than 20 jurisdictions across the country, totaling more than $34 million over the last 10 years. And we're not done. We are preparing a new round of matching grant opportunities that will allow states to establish or expand public-private partnerships to bring LifeSet to more young people. We do encourage the committee to explore how Georgia can take advantage of this opportunity to expand LifeSet statewide, ensuring that no young person ages out of care without a safety net. As I mentioned before, Youth Villages is not only a service provider, but we're also a national advocate for transition-age youth. In 2023, the National Collaborative for Transition-Age Youth was formed by 3 leading organizations involved in helping young adults who've experienced foster care. And those organizations are American Public Human Services Association, Foster Club, and Youth Villages. Its first project has just been released, and it's entitled Improving Outcomes for Young Adults and the Systems That Serve Them. And it's a playbook for best practices, which was co-designed with young people who have lived experience in foster care. The playbook is a roadmap for child welfare agencies, policymakers, and advocates who are committed to improving outcomes for young people who turn 18 in foster care.
Can you send us that?
We absolutely will. I was just going to say that. It also provides 8 overarching policy recommendations for state and federal action. For example, housing being a significant challenge for young people in many states, including Georgia, this playbook contains practical recommendations on investing in affordable housing. We've already talked about the FYI and vouchers. And so in order to leverage these housing resources to their fullest potential, we believe that there should be a robust process for the state to review the utilization of existing vouchers and the need to request additional vouchers from HUD when utilization supports that ask. It's also important to understand and help young people remove barriers to accessing vouchers, such as the example that I shared earlier about the young man. We will provide that playbook to you all as well. What we think is most important, what Youth Villages believes is most important, along with a lot of my colleagues, is that young people with lived experience must be at the center of any effort to improve the system. And we did see some of the young people speak back in a few weeks ago, and that's why Youth Villages has created what we call the Lived Experience Corps. And this is a national group of young adults who aged out of foster care and now work with Youth Villages to inform program design and advocate for policy change. These passionate young leaders are shaping the future of child welfare. Their insights have led to meaningful improvements in how we deliver services and how we advocate for change. And they remind us daily that this work is not just about systems, but it's about people. So some of the things that we would like for you all to consider as I kind of wrap up is, one, becoming a potential champion for public-private partnerships that bring innovative and evidence-based services to scale. Also, engaging with the Transition Age Playbook to inform policy and practice. And as you guys are already doing, continuing to elevate the voices of youth with lived experience in all decision-making processes. I do want to also extend an offer for us to bring one of our young adults back to one of the sessions to talk about their experience in our LifeSet program. We have information packets to contain some resources on national statistics, more information on our LifeSet program, along with outcome data. And together we believe that we can ensure that every young person aging out of foster care in Georgia has the support and resources they need to succeed. So we want to thank you all for the opportunity to share more about Youth Villages Georgia, the work that we're doing in Georgia, and for your commitment to improving the outcomes and services for Georgia's young people. We're open to any questions.
Thank you very much, and thanks for getting us more information that we can hopefully take advantage of. I think we all agree with people who have been through the system really resonate with the people on this committee and also other people that are listening to the conversation and paying attention, because they highlight things that they've actually been through themselves, and I think we're going to have more of that at our next meeting.
Okay.
So thank you very much.
Great. Thank you.
Questions? Okay, thank you so much for
I
being
have
with
the
us.
packets for you. The playbook
Okay.
is not in here because it was 60 pages, and I wasn't going to try to find
Great, you can give them to Hannah and she'll get them to the rest of the committee that couldn't be here today. Thank you. Okay, Ebony Harris from Youth Empowerment Success Services. We'll get your presentation pulled up. Thank you.
Good morning, Madam Chairwoman and committee. Can you hear me?
Yeah,
I can't hear myself.
yeah, just speak loudly.
Okay. I'm Ebony Harris, the founder and CEO of Youth Empowerment Success Services. We are a organization that is focused specifically on young adults who are aging out of foster care and experiencing homelessness. What makes us unique in what we do is that we specifically work with this age group, but we also focus on the intersectionality of both homeless youth, youth who are experiencing aging out of foster care, and those who we consider episodically homeless, which means they don't fall in a bucket. And so we focus on a continuum of support to work with those young adults. So again, our mission is threefold: safe and affordable housing for young adults, teaching them practical life skills in a life setting, as well as helping them identify a support system, and not a system, but people to help them as they transition into adulthood. And how we explain that to people is we want to ensure young people are connected to people that are not paid to be in their lives once they transition out of our services. Our core populations, as I said, are specifically, we're an independent living program focused on those that are in extended foster care through DFACS, and we work with them up to 36 months. 86 months is the age of 18 to 21, and sometimes we have very little time because they don't come to us at that age of 18 at all times. And then we also are a recipient of the Youth Homeless Demonstration Project through City of Atlanta, Balance of State, which focuses on Gwinnett and Clayton counties. And then the Episodically Homeless program is focused on, we have a small grant through Fulton County that provides housing. All of our focus and our model focuses on scattered site model. So we work with property owners and communities across Metro Atlanta, Georgia, and we master lease units. Then we support young people in obtaining housing on their own. We have a life coach team that is focused on and available to our young people 24/7 to assist them with daily living, cooking, budgeting, things that my colleagues has already said. But what I want to also, when we talk about the extended foster care, and we opened up very clearly about that foster care cliff. At 18, the young people that are aging out of foster care are up into the age of 18, they're pretty much told what to do. And then magically at 18, they're expected to know what to do and have the answers. And so we are tasked with trying to provide them with a variety of skills within a finite amount of time to get them ready and make life-changing decisions in order to make sure that they are equipped by the time they turn 21. And sometimes 21 comes sooner than all those things have been achieved. For example, Allison spoke about this, but we do this every day. Young people don't have the basic skills to even cook a meal, do laundry, learn how to take public transportation, manage their medication, all the things that they were being assisted with prior to 18. Now they're expected to do all of that, as well as ensure that they have an education and an employment plan. And so we work with a variety of organizations to assist young people with achieving their post-secondary support, job placement. But one of the things that we don't talk about is making sure young people can pursue their education so that they can have a livable wage. And sometimes our young people have to choose between education and a living, and they don't choose college or post-secondary due to some of the challenges, but they're also leaving our programs not obtaining a livable wage. We also, one of the things that we do in our organization is that we employ young professionals with lived experience. That's a challenge in itself. However, but what we notice is that when young people are working alongside those who have come through the system, they have better outcomes because they see people that look like them, that have gone through what they have gone through, and they are able to relate, and their outcomes are better. We also work with them to identify natural supports. We do work with community partners to ensure that they have a mentor, like a structured mentor. But one of the things that we also learned about this population is that they have support systems, and we want to help them foster those support systems, as they navigate through the child welfare system as well. As we talked about our independent living, we call our independent living Youth Quest. One, these are young people who voluntarily remain in care between the ages of 18 and 21. They have a self-sufficiency plan, and this is a plan they develop, not one that is court mandated. It is, we start with where they want to start from, and we work their plan to help them obtain self-sufficiency. I want to just kind of focus on two things when we talk about the intersectionality, because what we're seeing in our youth homeless demonstration project is about 15% of those younger people that are in our homeless demonstration project are former foster youth that may not be eligible for the foster care supportive services or extended care. And that is a big challenge. The other thing that we are finding is that 21 is not enough time for our young people to obtain all the necessary skills they need to be able to transition successfully, because in our transitional programs, we see those young people come back. Thankfully, we have small grants that allow us to provide rental assistance, emergency support, and things of that nature to these young people that come back that may not be eligible for other services. However, the need is greater than what we have to be able to support these young people. We also noticed that we offer housing navigation. So we have a team working with our young people and in all of our programs to ensure we find and establish affordable housing and work with them to create a sustainable housing plan as they navigate through education, employment, life challenges. Some solutions to consider is to expand stable housing and life coaching beyond the age of 21. And also fund provider capacity to deliver those supportive services. My colleague said that previously, but what we're finding is that young people between that sweet spot of 21 and 23 are still finding themselves, even if they age out with the lease in their names. When a life issue happens, they don't have the resources. It could be something as minor as a car breaking down. We can help them fix that car, but they've then lost their job, they're not able to go to school, and they're back in the same situation, and we see them in the continuum of our homeless system. And being able to formalize those public and private partnerships and with the community-based organizations to have us undergird those young people, because young people come back to us in the community. They're not necessarily going back to the state entities. They come back to these community-based organizations where they know that they had that support for that 3 to 4 years that we've been working with them, and incorporate. And the last thing I will say, and our colleagues said this all the time, youth voice is very important in what we do, and if they're not in the center of what's happening, we are working around them and not with them. That's my spiel.
Thank you so much, and I really appreciate you and the other speakers bringing us some solutions to consider, because that's what we're trying to do at the end of the day, is come up with some recommendations, some of which will be legislative and some won't be. You also highlighted something that keeps coming up in addition to the lived experience and getting those kids engaged. It's the mentorship, and the trusted adult was another term that was used. That seems to be missing, and that has worked so well in the veteran community with the accountability court system, where each person going through that system is assigned a mentor. They're all volunteers, and that's been very effective. So I would like to see if we can figure out a way to enhance the mentorship possibilities.
And through the cohort that we talked about, the transition age youth, I chair the housing committee, the housing chapter now, that was the committee. But what we found also, again, some of my colleagues talked about that, an evidence-based case management model, affordable housing, and ensuring that the independent living providers within the DFACS community have an evidence-based model, and we're working along the same playing field to equip these young people, because they can go from one provider to another and it's vastly different of their experience, and having to be able to have a continuum of support as they matriculate through the system.
Thank you very much.
You're welcome.
For the work that you do and for coming to speak to us.
Thank you.
Okay, Katie Stone with Chris 180.
Good morning.
Thank you for being with us.
Pleasure to be here. My name's Katie Stone. I'm the president and CEO of Chris 180, and I am joined by my friend and colleague Rick Aronson, who is our chief operating officer. Thank you for this opportunity. Chris 180 our organization was founded in 1981, so we've been serving the Metro Atlanta community for 44 years. We celebrated our 44th birthday in June, and in that time we've supported over 250,000 of our neighbors. When we started in 1981, we started as the state's first specialized group home for children and youth with behavioral and emotional challenges. And since 1981, our name has changed several times, but like Shakespeare says, what's in a name? We started as Georgia Charlie, we then became Chris Homes, then Chris Kids, and we are now Chris 180. But the important thing for you to know is that our roots are deep in the mental health space and in support for foster children. We are focused on 3 core impact areas: mental health, counseling, and therapy. And we do that through providing services in counseling centers across the metro area. We also have counselors embedded in 80 schools across the metro area. And then we provide telehealth services, and we provide services directly in community hubs where people live, work, play, and pray. So it's all about providing that community-based mental health support. We also provide foster care and adoption placements, so ensuring that children have safe, stable, and loving homes. And our transition planning starts at age 14 with an initial assessment on the potential for youth to move into independent living models. And third, we support youth experiencing homelessness through our drop-in center for homeless youth and through our Summit Trail apartment community, which is a 41-unit apartment complex where individuals aging out of foster care or those facing homelessness can find safe housing, but also life coaching, so the mentorship that many of our colleagues have talked about today, financial literacy, job preparedness, tutoring, ability to get their GED, and it's a 24-hour available support. So we're not there just for the kids during the day, but anytime that they need us, we have people on site to support them. And then across all 3 of these areas are our wraparound services that are part and parcel of everything that we do, stepping in to provide that unique, individualized care, particularly for those that are facing complex challenges. And where we are is everywhere people in the metro area are, where we are needed. So we provide services in 5 counseling centers, and as I mentioned before, we also provide telehealth services. We are embedded in 80 schools, and what's beautiful about that is the kids are able to access mental health services right there in the schoolhouse where they feel safe. We also provide services for their families in the schools and for the teachers and administrators, helping them create tools to support the kids in their care. We are in community-based locations all over the metro area, in Fulton County Clubhouse, for example, at all of the At Promise centers. And then we are in places of worship. We provide services in workplaces, anywhere the need is. We have our drop-in center for homeless youth on the east side of Atlanta, our Summit Trail apartment complex on the east side that I mentioned, and our training center also on the east side. And we're really excited to welcome you for a tour after this hearing today. One thing that's important about our locations is we are meeting kids in foster care and those that are aging out of foster care at all of those locations. It truly is a community-based approach where we're able to meet them where they are and then provide services where they are needed. At our core, Chris 180 is a mental health organization, and in 2024 alone, we provided over 64,000 behavioral health services, the majority of which, almost 80%, were provided to youth age 21 or younger. We work in a trauma-informed model, which you've heard from many of our sister nonprofits and service providers today. And clearly, kids in foster care, those aging out of foster care, have absolutely experienced trauma. And each foster care youth presents with a unique set of needs. And in most cases, a primary need is mental health and behavioral services. And we understand that increases in funding may not be on the table for 2026, but we would be remiss if we didn't talk about the importance of mental health care as it relates to the needs of foster youth, and in particular those who are aging out. 80% of youth in foster care experience a mental health challenge. 80%. That is not something that we can ignore. What we know, though, is that current rates do not cover the true cost of providing mental health initiatives and other support services. So, like many of our sister and brother service providers, we are dipping into our own funds in order to provide these vital services for these youth. And I want to draw a connection for you between all of the testimony that you've heard already today about housing and mental health. There is a direct correlation to those two things. Partners for Home did a survey in 2024 that showed specifically that when people with mental illness were placed in supportive housing, over 85% remained in stable housing for a 12-year period. 12-month period, forgive me. 12 years,
We're working on 12
years would be the goal. So the bottom line is that housing and mental health treatment reinforce one another, and we really shouldn't be separating those two. It needs to be provided in cohesion with each other. So the gold standard for youth in foster care and those aging out of foster care is to marry those two things together, to provide the stable housing and that wraparound service that provides that mental health care support. But there is not currently enough funding to provide both. And that is certainly a gap that we need to fill. Additional challenges that we want to bring to your attention, many of which have already been mentioned today, but are important to make sure that we reiterate, are the lack of education and workforce development opportunities. And I'm excited to come to the next hearing and learn more about your analysis as it relates to workforce. Another is the complexity and inefficiencies of navigating and securing the rates and benefits needed to meet the unique needs of the youth that we support. It is not an easy system, not only for them, but also for the service providers. And what we have seen is sometimes it's who you know or what you know gets you to the ultimate benefit. And so in other words, it's complicated. And we have many service providers that are very experienced, they've been here for a long time, but it shouldn't be hard. We need to welcome new people into this profession who can immediately know exactly how to help navigate these youth. But we are not to that place, and so we need your help with that. We would also like to see a greater involvement by DFACS after assignment. So more of a partnership with the service providers to ensure that, especially during that transition period, the youth are supported by the service providers and DFACS together. And then the last thing I wanted to bring to your attention, which again has been mentioned before, but is worthy of bringing up again, is lack of system navigation educational resources for youth in foster families. So developing those tools and resources that explain the processes, explain the timelines, the preventative measures, and other available resources will be key. And I think that would be an incredible effort that all of us in this room would love to be a part of, that would yield dividends immediately. Thank you. Any questions?
Thank you so much for being here. I actually believe that Chris 180 is in my district, the summit. Yeah, I picked it up, which I was excited about. Can you say a little bit more about what sorts of mental health diagnoses you're seeing and how often they are more severe than sort of, what you might see with average anxiety, because sometimes you would say, okay, well, this amount of children have a diagnosis, but it could be generalized anxiety disorder, or ADHD, or something. Like, how much more often are we seeing like schizophrenia or oppositional defiant disorder or things like that?
So it's based on their lived experience. You have the same standard diagnoses that you would have in any mental health practice: the anxiety, the depression, the schizophrenia, the ADD, the autism. It's compounded by the trauma that these folks are facing. So there really is the baseline that all of us are dealing with on a day-to-day basis, compounded with that challenge of the trauma of the experience they've lived in and the gaps that they've had in their lives, making recovery and support that much more difficult.
Thank you.
This is, I think, not something you can actually answer, but I'm concerned as I'm listening to the conversation just about the rest of the state. So it seems like a lot of resources are focused in the metro area, but we know that all around the state we've got kids that go into care. And I'd like for you all to think about that. If you have any suggestions for us about how to kind of broaden our scope on that.
Well, it was mentioned briefly. We have a training institute at our main campus. And so what we try to do is provide that trauma-informed lens to other providers, to mom and pop and startup providers that don't have the history and the experience that we do. We can't, of course, be in every location, and we want to be great in Metro Atlanta, which is our core service area. But we do, for example, work with other providers in Savannah to provide the wraparound services. So while we can't provide the whole array, I think a recommendation would be to tap into the expertise of all of these folks in the room and be able to provide some of that to more rural and remote communities.
I agree with you, and I think the challenge is always getting the word out to the people around the state about resources that they might be able to tap into. So that might be a project. But thank you so much for the work that you do.
Thank you.
Okay, and our last but not least speaker, Rachel Castillo from Advocates for Children. Did I pronounce it right?
You did.
Okay.
So thank you very much, Senator Kirkpatrick. What a privilege it is to be here with you in the committee this morning. This is a subject that is so near and dear to my heart. I'm just excited to be here to share with you today. So Advocates for Children is a regional nonprofit serving over 20,000 children, youth, and families annually across Northwest Georgia. Through prevention, advocacy, housing, and family support, we strengthen families, protect children from abuse and neglect, and provide youth with safe pathways to independence. Our continuum of care includes crisis response, long-term housing, court advocacy, and prevention services. And so we are located in Northwest Georgia, serve 11 of those counties, headquartered in Cartersville, Georgia, with offices in Cobb, Gordon, and Floyd counties. And you felt like you set me up perfectly when you started to talk about resources outside of the metro area, because it could be as much as 10 to 1 with the money coming inside the perimeter to what is being invested outside of the perimeter. And we really need some of those resources. One of the things that Advocates is looking to do is to become that Medicaid provider, because there are not many up in that Northwest corridor. So what do? We provide services in 3 core areas: advocacy and justice, housing and stability, and child and well-being. And we do that through 11 different program areas. The 2 I really want to focus on today are prevention and housing and stability. So we saw some gaps, and they're very similar to everything that my colleague said earlier. We are seeing youth that are coming into foster care that should not be there. We run prevention programming in Bartow County and Cobb County, and we are trying to prevent children from entering the foster care system due to simple housing issues, not having furnishings, whatever might be the area, and bringing those wraparound supports into that. Youth are not prepared to live independently as they transition out of care. As we started receiving youth, we realized everything that you heard Ms. Ash say regarding the skills with knives and driving and all of those things needed to be retaught. The length of time, this is what you heard too, is not adequate. Children, I have 2 in college right now. They bounce back all the time. Mom, what do I do? You know, they do not have mom, what do you do? And 2 years, 3 years is not adequate time to be able to answer those questions. funding sources are not integrated to help with housing stability. We have to search and try to layer all kinds of funding to make sure that we can just do one program. So our prevention model that we use is called the Family Resource Center model. And we started this in 2022, last year served over 1,000 youth that were about to enter into the foster care system. All of our referrals are coming from Cobb County DFACS for this programming. We served what we called 58 families with navigation. That means that we worked with that family for 12 full months to ensure that they did not have to have their children removed into the foster care system. At this time, we have a 100% success rate. None of those children that we intervened with financial supports and cash assistance entered into the foster care system. Just though a month ago, we learned that that funding has been cut on the prevention side. That was DHS funding, and we have to limit or when we should be scaling this program because we know the cost savings that will happen when a child does not have to enter into the foster care system. Additionally, I want to talk about what we do with our housing and transition supports. So this is Newman House. This was newly constructed. We are waiting for our final licensure from RCCL before that we can open. But this was our response when we were realizing that children were not prepared to transition out of foster care. This is a 14-suite facility that is set up to help them thrive and learn independent learning skills. So inside of this, those suites all have a kitchenette, a private bedroom, and a private bathroom. And additionally, it has common areas where they can interact with their peers as well. It also has a full commercial kitchen so that we can do community meals, but also has an outreach center, drop-in center, and a runaway and homeless youth programming are operated out of here as well. But so this was so that they could start learning how to prepare meals while they're in this. If they don't like the main meal, they could take and do something in their own room. There is an education space in here because we employ a full-time teacher because of the educational gaps we see. She works with credit recovery, making sure children have IEPs, making sure FAFSAs are completed, helping them apply for colleges, looking into trade schools, whatever that child issue might need around education support, we do that right on site through our CCI. We also want to make sure that when we are transitioning anyone out of our programming, they're going to be successful. But we also know when our children turn 18, sometimes they don't want to continue in such a supervised thing. And that is why we looked in 2019 to start using HUD Rapid Rehousing dollars before the Youth Homelessness Demonstration Project. And so we started that program where we house youth 18 to 24 and provide them full wraparound services. This helps build their credit. We didn't talk about that, so I wanted to say that because we're leasing apartments in their own names. We're helping them where zero rent could happen, and we integrated transitional housing in this program too. We made a decision not to use ILP, TLP programming from DFACS to do our programming, but to use HUD programming to offer those children the freedom not to have those restraints. This is completely independent, self-directed with our case management. So these youth, now that we have transitional housing in place with us, can be with us sometimes up to 3 years in our programming. So far in 2025, we are operating 49 independent living apartment units in those youth name. We have 16 transitional housing beds filled that are in our name. We have 186 individuals served this year. One thing we haven't heard yet, I don't think, is that 121 of them are youth. 65 of them are their dependent children. A third of who we're serving in that program are children of that youth. And so that complicates everything. When you're trying to work with an 18, 19-year-old that might already have 1, 2, 3 children, it takes time. I love it. Someone said time, prevention, prevention, prevention. I want you to hear those two things today because those, I think, are the key to be able to do this. What our outcomes were in 2025 so far is that 96 of the clients that entered our program, we've got them housed within 60 days, which means we were able to use our search and placement staff to find housing, work with landlords to help build that rapport and get them housed. And after they've graduated our program, after at least 90-day follow-up at this point, 84% of them have maintained their housing in their own name. So I do have a few recommendations. We need to invest in prevention. I was speaking with someone the other day. There are $4 that the government, Georgia has access to, that they've only done very few pilot programming and not in the region where we serve. If we could try to figure out a way to utilize those dollars to support and prop up the FRC programming, I think that would be smart. We need to expand that case management support to 24. We need to protect education, make sure we're investing in teachers to be able to work alongside of nonprofits and different things to make sure these children do not waste time in their school. maximize those housing resources in Cobb County. You know, that is your county. There is no youth housing demonstration program. There's no COC funding. The only thing available is TLP and ILP, and we are trying to get that going there. But how can we do that? Also, the comment was made about the FUP vouchers a couple of times. There are 0 in rural Georgia right now. It's not an underutilization. They were not awarded by HUD. And so I also serve on the DCA COC board. I'm not here in that capacity, but you know, HUD has to award them before we can use them. So we need to make sure we figure out what went wrong with that application and get that to work better. And then again, let's just continue to scale those things. So the bottom line, we know prevention saves money and trauma. Housing and consistent supports help you thrive. And we know that Georgia has models that work. We just need the resources to scale them. Thank you very much.
Thank you so much. I missed where the Newman House is located.
Cartersville, Georgia.
Cartersville.
Mhm.
Okay.
Serves Region 1 of DFACS.
And you just raised the money and did that with private funds?
Yeah, we just completed, we started out at 4.9. Construction costs went crazy during the pandemic, so we ended up a little bit $8 million to do that in our main office building. But yes, that's how we did that, through private funding. We also did receive some ARPA funding during that time as well that contributed to the construction of that building for the runaway and homeless youth portion.
Thank you so much. We've heard about the education credit transfer issue that was on your slide at the last meeting, and I'm sure we're going to hear more about that at the next meeting. So appreciate the work that you do.
Thank you very much.
Thank you so much. So we are out of time, and boy, we've heard a lot of great ideas today, and there's a lot of people doing great work, and we've got to figure out how to make that available to all the foster kids, because they didn't end up here because it's their fault, and that is really the focus, is to try to help get them what they need, knowing that they have already experienced trauma in their lives. So thanks to all of you for hanging in there with us, and we will have another meeting on October 15th, and hope you can join us. Thank you so much.